Asthma is a common and potentially life-threatening condition, and its severity is often not recognised. Asthma is a medical condition characterised by intermittent, reversible airway obstructions. Asthma is a condition that affects the airways, the small tubes that carry air in and out of the lungs. When a person with asthma comes into contact with something that triggers their asthma, which is called an asthma trigger, the muscles around the walls of the airway tighten so that the airways become narrower and the lining of the airways become inflamed and they start to swell. Sometimes sticky mucus or phlegm builds up and it can further narrow the airways. All these reactions, because the airways become narrower and irritated, make it difficult to breathe and also leading to symptoms of asthma. Asthma is a common condition and its varying levels of severity from mild to fatal. In the UK, around 2,000 people a year die as a result of asthma. There are around 5.4 million people in the UK currently receiving treatment for asthma, 1.1 million children currently receiving treatment for asthma, and finally, this equates to around 1 in 5 households in the UK having someone with asthma. The signs and symptoms of moderate asthma attack include breathing difficulties, coughing, wheezing, distress, anxiety and exhaustion. Where asthma is classified as severe, the patient will need professional help as they will need to be given a nebulizer and steroids. Life-threatening asthma has the following signs and symptoms: altered levels of consciousness, cyanosis, which is the blue colouring of your limbs and extremities, indicating a lack of oxygen, hypertension, exhaustion, poor respiratory effort, peak flow of less than 33%, blood oxygen levels less than 92%, and a silent chest. If you see any of these, call the EMS as soon as possible. Sometimes, no matter how careful a person is about taking their medications and avoiding triggers, they might have an asthma attack. There are different medications for the treatment and management of asthma. People with asthma usually carry 2 types of inhaler: a brown one, which is the preventative, and the blue one is for the treatment of an asthma attack. The asthma inhaler is a plastic container and you have a cartridge on the inside which you can remove and replace. It's got all of the details on the drug and it's easy to pop back in. What the person will need to do is take the cover off and put it into their mouth. When they're ready to deliver the drugs, they simply push down on the button on the top and they breathe the aerosol in to their lungs. When someone has an asthma attack, it can be very frightening for the patient and they may have their own way of dealing with the attack. Sometimes all you can do is really get the inhaler ready for them and reassure them. If you interfere too much, they may seem angry, but they are fighting to breathe and the last thing they want is a first aider telling them what to do when they already know. If it's the first time someone's having an asthma attack, you need to treat it as an emergency and get them to a doctor or hospital as soon as possible, as you will not have the medications, therefore you can't treat it. Here are some guidelines that are suitable for both adults and children. As a first aider, we encourage the patient to use the inhaler. We do not actually do it for them. Try and find the history of the patient in relation to previous 6 to 48 hours prior to the attack. This information may be of help to the paramedics if the attack gets worse. Find their reliever inhaler, usually blue, as soon as possible and once you've recognised they're having the attack. Sit them down and ensure that any tight clothing is loosened. Don't lie them down. In mild cases, they may prefer to stand to initially take their medications. If no immediate improvement during the attack, they should continue to take 1 puff of their reliever inhaler every minute for 5 minutes until symptoms improve. If their symptoms do not improve in 5 minutes, or if you're in doubt, call the emergency medical services or a doctor urgently. They should continue to take 1 puff of their reliever inhaler every minute until help arrives. Don't be afraid of causing a fuss, even at night. Night or day, if they need to be admitted to an A&E department, so be it. Make sure you take their medications with them, as the doctors will need to know what has been prescribed and what's been taken. In most cases, the inhaler will deal with the attack and they will soon start to feel better. But if you don't see signs of improvement, or if they get worse, activate the EMS as soon as possible, even if the patient doesn't want to go to hospital. They may say because they don't want to make a fuss. It's better to be seen by a doctor to ensure they're okay and don't need any further care. If you're looking after someone's child and the child has had an asthma attack while in your care, Make sure you tell the parents and record any cases of asthma that you had to treat in an accident book if you're in a work setting.